Okay, good morning everyone. So I'm the clinical nurse at TriEx, and TriEx have been drug testing for many, many years. And what we've actually found is that over the years, more and more companies are actually doing drug and alcohol testing. So I'm specifically going to speak about pre-employment drug testing. But some of you out there might not ever have done drug testing before. So I am looking at issues around drug testing before you even get to doing the pre-employment. So who's actually taking drugs out there? Have a wee look around this room. I can guarantee that some people in here will be taking drugs, whether it's prescription or illicit drugs. So are there any stereotypes out there that actually take drugs? You may think possibly young males, caps back to front, age between 15 and 24. But in reality, there's actually a lot more different people that are actually taking drugs out in the workplace. So effects on drugs. So we need to look at how it actually affects people at work. It can alter the way that a person thinks, acts and feels. It can lead to impaired judgment and concentration and influences actual performance at work. Every year, New Zealand does a health survey, and every year they concentrate on different health issues. In 2012-13, it was published in 2015. It concentrated on some questions about cannabis use. Now, overall, through that period, about 13,000 people over the age of 15 were actually interviewed. 11% of adults aged 15 and over used cannabis in the previous 12 months. Now, if we take those statistics and make it nationwide, that equates to 397,000 adults have taken cannabis in the previous 12 months. 36% of the above actually drove while under the influence of cannabis. And the most prevalent was males, 35 to 44. 6% of those reported harmful effects on work or study. And 1 in 3 took cannabis at least weekly. So there are people out in your workplaces that are actually doing this. Law-wise, obviously there's been some changes, but certainly the HSWA and the GRWM regulations both actually strengthen requirements for a PCBU to provide more focus on protecting the health of workers. Now, it does talk about monitoring health and monitoring workplace conditions to prevent illness and injury, and that could actually include drug and alcohol testing. We all have duties with new laws and regulations. A PCBU must, so far as is reasonably practical, provide and maintain a work environment without health and safety risks. And that's not just the physical environment, it's psychological work environment, which does include drug and alcohols, along with fatigue and other stuff. Workers have duties as well. They need to comply with reasonable instructions from the PCBU and cooperate with policy procedures. That's why it's really important to have policies in place. And they need to take reasonable care for their own health and safety and that of others. So I know policy has been talked about, but just a quick summary about policies. They do need to discuss why you're actually testing. What's the purpose of the actual policy? Who's going to be tested? Is it specifically people in safety-sensitive roles, and looking at the roles that people within your workplace actually do? When will it be completed? Are you going to start off doing pre-employment testing and then go on to the post-incident, the reasonable cause? What will people be tested for? A number of workplaces use instant devices which cover 5 or 6 classes of drugs. But do you have a workforce where potentially synthetic cannabinoids may be used? Are you going to do alcohol testing as well as drug testing, which is usually a urine test? So lots of things to think about. Where do the results go? Who's getting that information? Really confidential information, so it's making sure that the person that's getting it is the right person and that can actually act on that information if required. The consequences of people engaging in prohibited conduct. What do you do if someone does fall off the wagon, if someone does present with a non-negative or a positive result? The testing procedures or processes in rehab. So lots of things need to go into that policy. Other requirements. As a health professional, I'm very aware about the Health Information Privacy Code. There are some things that, as a health professional, I can't disclose. And some of that may be certain medications that people are on. But obviously, we're not just looking at illicit drugs or illegal drugs. Prescription drug use can be misused as well. So we need to look at the big picture. And certainly when we have people coming in for pre-employment, we're not just doing a drug test or a drug and alcohol test. We're looking at people's behaviours. And it's amazing what you can actually pick up from people's behaviours. The Human Rights Act 1993 and the NZ Bill of Rights Act 1990. Certainly the NZ Bill of Rights Act, it does concern only specific employments. And those can influence whether a requirement for drug testing is actually reasonable. Consent is really important. It needs to be informed consent. People need to know why they're being tested, what they're being tested for, and as I say, who is getting those results. How records are stored, what they don't want is their records to be left on somebody's desk. It needs to be securely stored. With workplace drug testing, there are specific standards out there. And if you've never done drug testing in the workplace before, whoever provides your drug testing has actually got to make sure that they have certain processes in place. The drug cut-off levels and basically the drug workplace standard is the ASNZS 4308-2008. So it's well worth getting a copy of that standard to make sure that you're doing things appropriately and that the person that's doing your drug testing is doing things appropriately. The individuals that are actually doing the testing must have undergone training to be competent to do this testing, and there's 2 unit standards that they've got to have completed. The actual screening kits that are used actually need to have a certificate of compliance to make sure that they are working appropriately. And the company actually doing the screening or the individual doing the screening must make sure that they've actually got quality control processes in place to make sure, again, what they are doing and the kits that they are doing what they should be. So pre-employment assessment. When employers or PCBUs send people for a pre-employment, there's certain things that they want to look at for new employees. They need to make sure that individuals are fit to perform the tasks of the job that they're actually applying for. We need to detect any pre-existing condition that actually might impact on the job requirements. Provide baseline information for any ongoing required health monitoring. And also that can include drug and alcohol testing. Now, certainly we have some companies that have done urine drug testing in the past, but they've never actually tested for breath alcohol. And I do often get asked the question, why at pre-employment should we actually do a breath alcohol? At pre-employment, we're not too concerned about someone that's had a 21st birthday the night before. What we are looking is for that functioning drinker, heavy drinker, because if someone's drinking over and over again, then it can obviously impact. So for pre-employment drug screening, it actually sends a message out there to new employees. It shows that the company is serious about managing any drug and alcohol risks. It gives clarity about any expected behaviours, and it actually sets the culture and the standards. So what do you test for? As I said earlier, some companies might have a very young workforce and they're concerned about synthetics, but the most common types of drugs that we test for are listed there. So we've got cannabis, amphetamine type substances, which includes methamphetamine, which has obviously been in the news in the last few days, opiates, cocaine, benzodiazepines, and then breath alcohol. Then a company's got to decide, well, do we go immediately to laboratory testing, or do we do a screen test first, and then if it comes back is what we call a non-negative, it's not positive at that stage. If it's non-negative, then do we send it off to the laboratory? When people come for pre-employment testing, we've got to make sure that is the individual that should actually be there. So we do need some photographic evidence of who that individual is. Informed consent, really important, robust collection procedures, and making sure that there is no manipulation of drug tests or process. What we would recommend for pre-employment is an instant drug screen. If it's then non-negative, being sent off to the laboratory for confirmation, and a breath alcohol. And just at the TriEx stand at the top of the stairs, we've actually got some drug kits that people can look at. So there are different stages to drug testing. So the first one is where you get your negative or non-negative with the urine drug screen. Stage 2 is that confirmation at the laboratory. And certainly with the confirmation test, it will give you a level for specifically cannabinoids. The other ones, it will be a positive or a negative. I often get asked the question when someone has had a positive result back from the laboratory and employer. They phone up and they say, well, what does that actually mean? Does it mean they had some cannabinoids at the weekend, or did they have it 3 months ago? It's actually very difficult to tell. Every individual is different. Everyone will clear drugs from their system in different time limits. But there's some idea of how long drugs stay in a system just up on the screen. We actually have one very large employer that when they offer employment to an individual, the stipulation is that they are drug tested within 2 days. Now that company has very, very safety sensitive roles. So you can understand, looking at the sort of clearance times, why they actually have that within their standard, within their policy. They must have that drug test within 2 days of being told to go for one. Now, we talked a wee bit about statistics earlier, about how many people might actually be using drugs. There's probably about 200, 250 people here, which means that overall, potentially 20 to 25 people here have actually used cannabinoids in the last year. So if you are one of those 20 to 25 people, I would recommend the Alcohol Drug Helpline or drughelp.org.nz. For others that want more information about drug and alcohol, the Drug Foundation website is fantastic. There's masses of information out there about what to test for, the implications of taking drugs and the effects, and how to get help. So in conclusion, testing at pre-employment, if you're thinking about it, talk to us. We do have the stand out there. Really important. It gives you an indication. Think of it as a risk assessment. It gives you an indication about that individual. It sets the standard for that individual going into the company, and basically gives an indication of personal behaviours. And looking at the picture, who actually would you employ? We all we look fairly well kempt here, but just think about that sort of 20 to 25 people here. Thank you.